Welcome to iPEMS, a podcast series that teaches about pediatric emergency medication safety and equips providers with strategies for solutions. I am your host, Dr. Tiffani Johnson of the Emergency Medical Services for Children National Resource Center. Joining us today for this episode is Dr. Jane Knapp. Dr. Knapp comes to us from Children's Mercy Hospital, and today she will be talking to us about patient-centered care as a strategy for quality improvement and patient safety. Thank you so much for joining us today, Dr. Knapp. Can you start off by sharing with us how you define patient-centered care?
Patient-centered care, I actually look at it as patient and family-centered care, and I like to use a very simple definition. So patient and family-centered care means involving the patient and family as full-fledged members of the healthcare team.
And what role does patient-centered care and family-centered care have in the world of pediatric emergency medicine as well as medication safety?
One, I think patient and family-centered care means taking the time to really listen to both the child and the family as to why they're there in the emergency department, and find out sometimes the entire agenda for the visit. And usually you can do that best by sitting down when you go in the room, taking the time to have a face-to-face conversation, not answering questions with one hand on the door, and maybe trying to spend a little bit more time with the patient and family than you do, say, with the electronic medical record. I think another thing that it means is thinking how the child and the family see the visit. Looking through their eyes on what's happening to them in the emergency department, that they might be frightened, that this may be a totally new experience for them, that they don't understand what's going on, that these are doctors and nurses and other healthcare members that they've never met, and that the emergency department visit is a big unknown for them, and it may be something that's making them feel like they've lost a little bit of control.
We've discussed patient-centered care as one of the IOM quality domains. Do you think that patient-centered care really does have a role in medication safety specifically and reducing medical errors?
I actually do think that patient-centered care impacts medication safety. And when you first think about it, or at first blush, you might say, well, how? But again, I go back to my patient experiences, and I try to relate it this way. So think maybe about an emergency department visit where you go into a room and you ask, say it's a child with asthma, and you ask about medication. You say to the mom, what meds is your child on? And the mom looks to the 9-year-old child and say, what are you taking for your asthma? Now, at first, when we first think about that, you say, well, that's the mom's problem, but it's really a medication safety issue for all of us, because it takes us to our teaching role as physicians, and we know that there's something not right in terms of the 9-year-old being in charge of their own medications. If we took another example, we might ask a parent, well, what antibiotic is your child on for their ear infection? And the mom might say something, well, they're on the white one. I don't know the name, it's in your records, isn't it? And we'll say, yes, we can look it up. But again, I think we're missing the boat if we've prescribed a medication for a child and sent the parent out, and they still haven't made the connection with what the medication, the name of the medication and the dosage that their child's taken. Another example, a child has what we think is an unexpected reaction to a medication, what we might term now as an adverse drug event. And what do we tell the parent about it? Do we say it's an allergy? Do we talk to them about the implications it has for this child in the future? Do we talk about follow-up? Do we tell them what an adverse drug event is? To us, it makes a lot of sense, but to a parent or a teenager or a child, it just might be medical jargon. So we have a lot to do in our teaching role with regards to medication safety. Another example, a child and a parent are in a room and a nurse comes in with a medication and says, here's little Johnny's medicine. And the mom says, well, what is it? And the nurse says, well, it's what the doctor ordered. And I think that our approach needs to be one of full transparency. First of all, the mom should already know that her child's getting a medication, and it should come from us, the physicians. Secondly, the nurse should feel free to say, this is the child's amoxicillin for the first dose of the ear infection that Dr. Knapp wanted him to have before he went home. And the mom either says, okay, that's fine, I agree with that, or she might say, I thought I told Dr. Knapp that my son is allergic to amoxicillin, and then we've avoided a medication error. So I think those are all clinical examples that I've seen in my practice. But here's another thing that we can do. Patient-centered care says that we should go to our patients and families and ask them, what should we write into our medication policies in the emergency department from your standpoint, to make sure that they're safe in terms of giving your child a medication. And I think that they can give us a very different perspective than the healthcare perspective, but one that's really, really important, because of course it is their child who's being treated. And I think that making them members of the healthcare team helps them not only when they're in the emergency department, but when they're trying to cope with that child's illness outside of the emergency department.
And finally, do you have any advice for the trainees who are listening to this podcast, medical students, residents, as well as fellowship trainees, so that they can apply these principles of patient-centered care in an effort to improve pediatric medication safety?
You know, my final advice is always to put yourself in the parent or the family member's role. And it comes from a personal perspective. I think as a resident, many times I wasn't at a point in my life where I'd had that perspective of being on the other side of healthcare. And once I started to be involved in caring for family members, I really started to learn how to communicate with families better, and I think it really helped me to grow as a physician. So even if you're not at that point in your life, try to see what you're doing as a physician from the family member's role, and I think it'll help you in terms of practicing really good family-centered care.
Well, thank you for joining us today, Dr. Knapp, and thank you to our audience for listening to this episode of iPEMS. To learn more about pediatric emergency medication safety as well as strategies for quality improvement, please listen to more episodes in the iPEMS series.